Do you have joint pain? If you do, you're not alone. 1 in 3 or 4 of adults have joint pain from arthritis, and 50% of breast cancer survivors who are taking aromatase inhibitors, like the drugs anastrozole or letrozole, also deal with joint pain and stiffness. Research has found that routine exercise can decrease this pain. My name is Kelly. I am a physical therapist that specializes in oncology and lymphedema. In this video, let's go through 5 exercises to help improve joint pain and stiffness. When it comes to exercise, we want to get clearance from your doctor if there is anything new of concern. And then we want to start gradually with simple movements like the few I am about to show. But as a hint, the goal is really to work up to focus on exercises like number 5. These exercises are best done daily and also as needed, like in the morning or after sitting for long periods of time. So for the first exercise for the upper body and the shoulders and the elbows, we're going to start with our shoulders at about 90 degrees, so about shoulder height. We can also have our elbows bent at 90 degrees, and then we'll bring our forearms to start by touching in front of us. From there, we're going to open up our arms. Feel a nice stretch across the front of the chest till your shoulder blades squeeze behind you. And from there, you're going to have your arms go straight up overhead, straighten out the elbows, make sure that you don't arch into your low back, keep your core nice and engaged, and then come back to the side, feel that stretch across the front, and then come back to the middle. Again, open up, feel a stretch, straight up overhead, tuck that core in, post your arms back and down, and then come back. And you can repeat this 5 to 10 times. Next is a runner's transition. So we can have 1 foot in front of us and 1 foot back. We can have both feet flat on the ground, or if needed, that back heel is okay to come up a little bit. From there, we'll have a little bend in the knee. We want to keep ourselves up nice and tall. We can lean forward into that front leg. Our knee will bend a little bit. And at this point, if you're keeping yourself nice and tall, leaning from that hip forward, you'll feel a nice stretch in the front of the hip, and you might also feel one down in the calf or the back of the low leg. And then come back and shift back. And then we can shift forward again and then back. And going back and forth 5 to 10 times. This is a nice one for the hips and for the calves, which affects the knees, and then also for the ankles. Going back and forth, nice and gentle. If it's too much, take less of a step, smaller step, and do the same sort of transition back and forth. If needed for balance, make sure that you hang on to a sturdy surface. It's also important not to have your feet in a straight line, but also a little bit wider for balance to make sure that you're steady. You could also repeat the same thing on the other side, opposite forward, opposite back, little bend in the front knee, shift forward and back. And if you feel this only in your low calf, try to use your hips to lean forward rather than just leaning with your upper body. Keep yourself up nice and tall to also feel the front of the hip. You can let that back heel come up a little bit if you also want to take some pressure off the calf, shifting back and forth. Next, we're going to work on the spine area or the whole low back. This one might not be appropriate for everyone, so it's best to talk to your doctor or a therapist before trying, but it's going to help loosen up some of the back. So we start with tucking the chin down towards the chest. From there, you're going to roll your body, thinking 1 vertebrae at a time, all the way down to the ground. And from there, you can tuck and bend at your knees and your hips to roll yourself up into a small ball. Feel that tension in your back. And then reverse it. So lift your hips up first, and then slowly start to lift 1 vertebrae at a time, all the way up, and then finish with bringing your head up. If someone is unable to do that or go all the way down to the ground, you can just tuck and roll from your low back, and then coming back up and all the way back up. This area gets really tight, so it's nice to be able to stretch out the low back, coming back up. Again, if someone has any pain or back issues, this one would be one to avoid or one to skip, or again, work with a doctor or a therapist on. But someone can repeat that 5 to 10 times, holding at the bottom for a few seconds as needed. The fourth one are finger tendon glides, so working for the hand and the finger joints, which is a really common one for arthritis, and also for someone who is on hormone medication. So starting with the fingers straight, and then from there, we're going to hook the fingers down, and then make a fist. The thumb can either be in the fist or relaxed. Straighten the fingers back up. Bend at the knuckles. The fingers are flat. And then bring the fingers all the way down towards the palm. And then start again with straight. So straight. Hook the fingers. Make a fist. Straight. Bend at the knuckles. Fingers all the way down. And straight again. And repeat that 5 to 10 times. And the fifth exercise, like I said, is the most important in the long term. Walking, swimming, tai chi, or something you enjoy doing is the last exercise. You may want to start gradually, maybe walking for 15 minutes a day, and then slowly increasing the amount of time you spend exercising by adding a few minutes a week. Or slowly increasing how fast you walk or the intensity level of exercise. The goal of this is to find something that you enjoy doing that keeps you moving and that you can do multiple times a week or consistently. And that's the best way to support your joints. The other exercises are nice for day to day or if someone, again, has been sitting too long. But the best way to manage joint pain is to find consistent movement that someone does on a routine basis. And again, the best way to do that is to find something that you enjoy. Now, when it comes to aromatase inhibitors, research studies have found that pain can improve 20 to 30% for those who exercise. The medication affects individuals differently, so it is best to continue to communicate and talk to your doctor on other ways to help manage the side effects that occur. But otherwise, those are exercises for joint pain and stiffness. I hope you all found this video helpful, and we'll see you all in the next one. Thanks, everyone.